Then we have kissing muscle, and kissing muscle we have two muscle like labial orbicularis oris muscle. Okay, Orbi, orbi, orbicularis oris muscle. Okay, because ocular muscle in the eyes, oris ocular muscle, and this muscle also have two part: marginal part, and second part we have labial part. Now I will show the labial part and marginal part. You know, this is the orbicularis oris muscle, this is the marginal part, and this is the labial part. Marginal part, and this is the labial part. Okay, these are origination from the lower alveolar process of the maxilla and alveolar process of the mandible and insert in the angle of the mouth. The same. Okay, this is very simple origination and insertion in the kissing muscle, orbicularis oris muscle. Okay. Then we have the muscle of the depth. In this muscle of the oral opening, we have muscle of the depth, and muscle of the depth I will show which is the muscle of the depth muscle. Okay, muscles of the depth. This muscle, the depth and kissing and smiling, this is muscle I told for your memorization. Okay, we will memorize very easily. This is the first mentalis muscle. Okay, this is the mentalis muscles in muscle of the depth, mentalis muscle, or you can say musculus mentalis. Then we can don't say in English. Okay, mental muscle in English, and musculus mentalis. Okay, origin and insertion. Origin and insertion of this muscle. You know, here we have origin here from the alveolar process of the where? Alveolar process of mandible, a lower lip. Okay, and insert it into the chin. Okay, skin of chin. Okay, skin of chin, you can say skin of chin. Okay, chin, this is the chin area. These are the muscles which we discussed. The muscle of the oral opening, we have 10 muscle, and then we divide each of have 5 other sub 5 section. Then we have muscle of the smiling muscle, then we have depth muscle, then we have satisfaction muscle, and muscle we have angle walking angle muscle, and then we have satisfaction muscle. Okay, smiling muscle we discussed zygomatic manner, and this muscle is presorus muscle. Okay, then we have muscle of the angle opening, which we have two types. We have depressor muscle. We have this was first one, angulus oris muscle, levator angulus oris muscle, and then we have levator, which one? So labia superior muscle. Then we have levator, and then we have depressor muscle, angulus oris muscle. Then we have depressor labia inferior muscle. Then we have satisfaction lateral wall. We have only one muscle. Its name is mesenteric muscle. Then we have kissing muscle. We have one muscle which name is orbicularis oris muscle, which have two part, marginal part and labial part. Okay, and then we have muscle of the depth, which have mentalis muscle. This one mentalis muscle, which origination from the alveolar process of the mandible. Okay, and inserted into the skin of the chin. Okay, these are the 10 muscle of the oral opening. Okay, next part we have in facial skull. We have muscle of the nasal opening. Muscle of the nasal opening. Muscle of the nasal opening, we already know. Nasal opening, we have two muscles. Okay, first muscle we have nasal muscle or musculus nasalis. Okay, this one I will show. This is a nasal muscle. We have two parts. Nasal muscle we have two parts. First one we have transverse part, and second we have other part. This one is transverse part and this is the alar part. Okay, now this is origination of the transverse part originates from the, if you remember, infra orbital margin, origin I will show from O. Okay, and insert it where? Cartilage, nose cartilage. Okay, cartilage of nose, cartilage. No, you know this is nose area, then you will know cartilage of nose. Okay, then alar part also here from, if you remember, here we have which also interior surface of the body of maxilla, origin, interior surface of the body of maxilla, maxilla bone, and insertion, where insertion we can say here the same cartilage of the nose, cartilage of the nose. This is the first muscle of the nasal opening, which is named nasal muscle or musculus nasalis. Okay, two part, transverse part, then we have alar part. Transverse part, infraorbital margin, origination and insertion cartilage of nose. Here we have the alar part. This is the alar part. This is a transverse part. Alar part with origination from the interior surface of the body of the maxilla and cartilage of the nose. Okay, then the second muscle. Second muscle is the same like angle muscles. We have superior. The second muscle we have, if you remember, levator, labia, superior, alque muscle, alque nazi muscle. Okay, or nasal muscle. Okay, origin and insertion. Now I will say which muscle. Okay, this is a muscle, and this is a two base. Okay, here first one is here originated from the where? Frontal process of maxilla, maxilla. Okay, and inserted here, go down to the alveolar process of the maxilla. Alveolar process of the maxilla. Okay, these are the levator, labii, superior, alque, nazi muscle, the nasal opening muscle. Okay, first is nasal musculus nasalis, nasal muscle. We have two parts, transverse part and alar part. Okay, different origination and insertion. Then we have levator, labii, superior, alque, nazi muscle, which we have origination from the frontal process of the maxilla. Okay, maxilla bone, and then insert into the alveolar process of the maxilla bone. Okay, then we have opening the last section of the facial muscle. We have muscle of the auricular opening, muscles of the auricular opening. Now I will show which muscle we have auricular opening. Okay, three muscles. This one, this is the auricular superiors, auricular anterior, and auricular posterior muscle. Three muscle means first is auricular superior muscle. Second we have auricular anterior muscle, and third one we have auricular posterior muscle. And very interesting, these all three muscles are inserted into the one place. You know, this is a auricular ear. They all muscle are inserted here in the auricular. Okay, now first if you will talk about the superior muscle, this one superior. Okay, this is superior auricular muscle, origin and insertion. Insertion I already told the same in all three bones. Origin from, if you remember here, what we have, gilla epineuritica, which we discussed about the fronto-occipital bones. It means gilla epineuritica. Epineuritica is the origination of this muscle, and inserted where? Auricular. Okay, auricular. I already told same insertion in all three muscle. Okay, then we have the second muscle. The second muscle we have anterior auricular anterior muscle. This one from where? Temporal origin, from origin and insertion. Origin from where? Temporal fascia. Why temporal fascia? Because when we will be going to discuss the mesenteric muscle of the head, there we have temporal muscles, and temporal muscle is covered by temporal fascia. Okay, it means origination from the temporal fascia and inserted into the auricle, the same. Okay, then the third muscle we have posterior. This one, posterior. Origination same, auricle, and inserted here into the inserted into the auricle, and origination from the temporal bone. Okay, these are the muscle which we discuss is the only facial group of muscle of the head. Okay, now we will going to repeat again. Short summary. First, we have facial muscle. Muscle of the head we divide into two groups: facial muscle and masticated muscle. But our topic about facial muscle, and facial muscle we have 5 sections. First section we have muscle of the skull. We have only one muscle. It's named fronto-occipital muscle, which have two belly, frontal belly and occipital belly. Occipital belly and frontal belly. Okay. Then we have originated from supreme knuckle line and inserted into the epineuritica, is occipital belly. Then we have frontal belly, originated from the gilla epineuritica and inserted into the skin of the forehead. This is the one muscle which we talk about, muscle of the skull. Then we have second section, muscle of the eye opening. Okay, muscle which around eye opening we have 3 muscle. First muscle we have orbicularis ocular muscle. We have 3 parts. The first one we have orbital part, the big part, which originated from the middle lacrimal ligaments and inserted also in the same place. Then we have second part, palpebral part, which originated from the middle lacrimal ligaments and inserted into the lateral lacrimal ligaments. Then the third part, which is a lacrimal part, and lacrimal part originated from the lacrimal bone, okay, facial bone, and inserted into the lacrimal sac. This is the first muscle of the eye opening. Then the second muscle we have procerus muscle. Procerus muscle originated from the bridge of the nose and inserted into the skin of the forehead. Then we have the third muscle. We have supraciliary muscle, which is corator. Pronunciation is very for me difficult, but supracell you can remember from supracelli muscle. Its origination from the gilla epineuritica, which are located between two eyebrows and inserted into the skin of the eyebrows. This is the third muscle of the eye opening. Third section we have the muscle opening around the mouth. Okay, and muscle of the around opening around the mouth we have other 5 section. Okay, subsection. We have smiling muscle. We have 3 muscle. Zygomatic major muscle, which originated from zygomatic bone and inserted into the angle of mouth. Then we have zygomatic minor muscle, which originated from the same zygomatic bone and inserted into the angle of mouth. Third muscle we have the small. This is a presorus muscle. Originated from mesenteric fascia and inserted into the angle of mouth. These are the 3 smiling muscle. Second, we have muscle of the angle opening. We have 2 depressor and levator and depressor. Levator we have levator angulus oris muscle, which originated from the anterior surface of the maxilla of the body of maxilla bone and inserted into the angle of mouth. Then we have second muscle, levator labii superior muscle, which originates from the infraorbital margin and insert into the angle of mouth. These are the elevator two muscle. Then we have depressor muscle. Depressor angulus oris muscle, which originates from the base of the mandible and insert into the angle of mouth. And then we have depressor labii inferior, which originated from the base of the mandible and insert into the angle of mouth. Okay. Then we have muscle of the satisfaction. Satisfaction, we have only one muscle which have mesenteric muscle, which originated from the alveolar process of the maxilla bone and alveolar process of the mandibular bone. Okay, and insert in the angle of mouth. Then fourth one, muscle of the kissing. Muscle of the kissing, we have only one muscle, which is called musculus orbicularis oris muscle. We have two part, marginal part because to the margin, and then we have labial part, lips part. Third, we have muscle of the depth, and we have mentalis muscle, musculus mental muscle, two muscle mentalis muscle, which origination from the alveolar process of the mandibular and inserted into the where skin of the chin. These are three sections we discussed. Fourth section is muscle of the nose, opening of the muscle around the nasal opening. Okay, two muscle. Nasal muscle, we have two parts. This one alar transverse part, and then we have alar part. Transverse part originates from the anterior surface of the maxilla of the infraorbital margin of the maxilla bone and insert into the cartilage of nose. Then we have the alar part, the same anterior surface of the maxilla bone and insert into the cartilage. Then we have the second muscle is superior labii levator labii superior oculi nazi muscle, which originated from the frontal process of the maxilla bone and insert into the alveolar process of the maxilla bone. Okay, and then we have the last section. We have muscle opening around the auricular. We have three muscles: superior auricular muscle, anterior superior auricular muscle, and posterior auricular muscle. These all three muscle inserted in the same place. I told is auricular, but origination different. Here we have gilla epineuratica for which superior muscle. Here we have temporal fascia for anterior muscle, and here we have temporal bone for origination for for posterior auricular muscle. These are the facial muscle which we discussed today, and very easy and very interesting muscle. Okay, thank you for watching.